Hello, my name is Rizame Gavar, and I'm going to be presenting the importance of infection prevention for healthcare workers. What is the goal of infection prevention? The goal of infection prevention in the home is to protect clients, caregivers, and the general community from the transmission of disease. This is particularly important for clients who are immunocompromised, who have infections or communicable diseases, or who have wounds, drainage tubes, or invasive access devices. Every year, lives are lost due to the spread of infections in hospitals. Healthcare workers can take steps to prevent the spread of infectious diseases. These steps are part of infection control. Proper hand washing is the most effective way to prevent the spread of infections in hospitals. If you are a patient, don't be afraid to remind friends, family, and healthcare providers to wash their hands before getting close to you. Other steps healthcare workers can take include covering coughs and sneezes. Covering coughs and sneezes and keeping hands clean can help prevent the spread of serious respiratory illnesses like influenza, respiratory syncytial virus, which is RSV, or whooping cough, and COVID-19. Staying up to date with vaccinations. Vaccines are recommended throughout people's lives. Adults are at risk. Most illnesses, hospitalizations, disability, and deaths from vaccine-preventable diseases occur among adults. Many adults aren't up to date with their vaccinations. Most adults are not aware of the many vaccines recommended for them. In fact, only about 1 in 5 adults is actually up to date, leaving many adults vulnerable. Vaccines help adults stay healthy and able to meet their many obligations. Adults need to stay healthy so that they can work, take care of their families and themselves, and fulfill other commitments in their lives. Vaccines protect loved ones. Vaccines can prevent adults from spreading a severe illness to a loved one. For example, getting vaccinated against pertussis can help prevent new babies in their family from this serious disease. And influenza vaccination reduces the risk of spreading illness to family members like infants and elderly people who may be more vulnerable to severe complications associated with influenza. Vaccines protect pregnant women and their babies. Pregnant women who get Tdap, an influenza vaccine during pregnancy, protect themselves and their babies from influenza and pertussis, whooping cough, influenza-related preterm labor in moms, and hospitalizations for their babies. Vaccines prevent serious health-related complications from vaccine-preventable illnesses. Vaccines can also prevent complications of infections that sometimes occur with the vaccine-preventable disease, such as damage to the eye from shingles or heart attacks brought on by influenza illness. Vaccines reduce risks related to other health conditions. Adults need vaccinations based on their age and health conditions. Some health conditions, including diabetes, heart disease, and lung disease, increase a person's risk of severe illness from vaccine-preventable infections. Vaccines help ensure adults stay healthy during travel. Getting sick while traveling can ruin plans and be costly. Adults should discuss any upcoming travel plans with their providers to make sure they are appropriately vaccinated prior to departure. Using gloves, masks, and protective clothing. PPE such as gowns, gloves, masks, and goggles provide physical barriers that prevent the hands, skin, clothing, eyes, nose, and mouth from coming in contact with infectious agents. Making tissues and hand cleaners available. Using hand sanitizer with at least 60% alcohol can help you avoid getting sick and spreading germs to others. And following hospital guidelines when dealing with blood or contaminating items. Most percutaneous injuries, like needle stick cut with a sharp object among DHCP dynamic host configuration protocol, involve spur, needles, and other sharp objects. Implementation of the OSHA bloodborne pathogen standards has helped to protect DHCP from blood exposure and sharp injuries. However, sharp injuries continue to occur and pose the risk of blood-borne pathogen transmission to DHCP and patients. Most exposures in dentistry are preventable. Therefore, each dental practice should have policies and procedures available addressing sharps safety. DHCP should be aware of the risk of injury whenever sharps are exposed. When using or working around sharp devices, DHCP should take precautions while using sharps during cleanup and during disposal. All used disposable syringes or needles, scalpel blades, and other sharp items should be placed in appropriate puncture-resistant containers located close to the area where they are used. Sharps containers should be disposed of according to state and local regulated medical waste rules. The nurse's major role in infection prevention is health teaching. Clients and healthcare caregivers need to learn about effective hand washing, use of gloves, handling of linens, and disposal of waste and soiled dressing. For routine dental examinations and non-surgical procedures, use soap and water for hand washing, or antimicrobial soap, or hand antisepsis specific for healthcare settings, or use an alcohol-based hand rub. Although alcohol-based hand rubs are effective for hand hygiene in healthcare settings, soap and water should be used when hands are visibly soiled. Example, dirt, blood, and bodily fluids. For surgical procedures, perform a surgical hand scrub before putting on sterile surgeon's gloves. For all the types of hand hygiene products, follow the product manufacturer's label for instructions. PPE that is appropriate for various types of patient interactions and effectively covers personal clothing and skin likely to be soiled with blood, saliva, or other potentially infectious materials, OPIM, should be available. Nurses use gloves in situations involving possible contact with blood or bodily fluids, mucous membranes, non-intact skin, exposed skin that is chapped, abraded, or with dermatitis or OPIM. Used linen must be handled with care to prevent environmental contamination with excretions or secretions, skin scales, or bacteria. Staff must wear gloves and linen must be bagged at the bedside, never shaken or allowed to touch the floor. No extraneous items must be placed in the laundry bags, especially sharp objects. Clinical waste is produced from health and social care. Clinical waste can either be hazardous, waste that poses or may pose a risk of infection, for example, pads and dressings, or non-hazardous, which is not infectious waste. Waste containers should be handled carefully to avoid contamination. Where appropriate, you should use PPE to protect you from contamination and infection. It is placed in either yellow or orange plastic sacks. It should be kept separate from other waste and disposed of using specialist facilities. Handling the home health nurses' equipment and supplies. Infection prevention can present a challenge to the home health nurse, especially if the home care facilities are not conducive to basic aseptic requirements such as running water for hand washing. An important aspect of infection prevention involves handling the home health nurse's equipment and supplies. Supplies may include materials for hand cleansing, assessment equipment such as a stethoscope, blood pressure cuff and manometer, thermometer, and tape measure, infection control items such as gowns, goggles, masks, gloves, and blood spill kit, and antimicrobial cleaning agents. The same organizations that accredit hospitals evaluate home health nurses' practice. Although some modifications in technique may be indicated in the home setting, such as the use of clean rather than sterile technique in caring for chronic wounds, all of the basic principles still apply. Nurses need to follow agency protocol about aseptic practice in the home. Here's something to think about before I end. 2.44 million people have died right now due to COVID. So it is very important that infection prevention is taken seriously. So I now end this presentation. Thank you so much. Please stay safe and thank you for listening.